Welcome back to the Humble Healer podcast. And today we'll do the home medical care tips and tricks part two. Previously, we talked about on part one, we talked about the choking rescue at home and in the public, and also foreign body removal from kids' nose using the mother's kits and other techniques. And then talk about tick removal. What's the best way to remove ticks from your body, and then also button battery removal and ingestion. The danger of the button battery with the alkaline content that can perforate the esophagus, and what the role of honey is in reducing toxic effects. And then two magnet ingestion, how the magnets, when they come together with the bowel, can cause perforation. And in part two of this tips and tricks, we talk about poolside drowning resuscitation experience from an ER physician in LA. And today we'll continue with part three. We talk about more ingestion of foreign bodies by children. So ingestion of paperclip, unlikely to pass through the twists and turns of the small bowels. So there is risk of bowel perforation, but the failure to pass is of greater concern. So paperclips, once evaluated and discovered on X-ray, should be referred to the specialist general surgery to monitor and observe until it's cleared by surgery. Screws or any sharp object in ingestion, if presented in the stomach, should be removed to avoid injuries and perforation of the stomach. But if presenting in the small bowel, then it can be observed and followed with serial X-ray to make sure it passes. Marble ingestion, only watch for obstruction for big marbles. Minimal risk of tear or perforation, and patients can typically be discharged safely for the most part. Now we move on to removal of foreign body, starting with splinter removal. Try to remove in one piece and ensure you have good access, and use small tweezers to avoid fragmenting the splinter. Ensure thorough irrigation to avoid contamination and infection. And tetanus is important since splinter is usually covered with dirt, or definitely the possibility of soil contamination with tetanus. For ear foreign bodies, ensure that you have good visualization before attempting to remove. Do not want to poke around without seeing what you're doing due to risk of ear canal trauma and bleeding, and also risk of pushing the foreign body deeper, making it more difficult for anyone to do it after. And it makes it more difficult to see. Long skinny forceps is the best tool to use. In medicine, we have a pair of forceps called the alligator forceps, which is one of my favorite to use to remove. It's very long, skinny. It has two clamps at the end. You can go very far, open the wraps, something tight, and pull it out. Very gratifying once you can do it. Insects can also be removed, and the best way a lot of time is you can soften it and eventually flush it out. Fish hook, we've seen that in the summer a lot, and I think I've seen one case and assisted in the removal of fish hook in one patient so far this season. You will see on the internet the yank technique, where you tie some sort of a string to the fish hook and you just yank very quickly. Of course, on the internet, they always work well, and they probably didn't show you the first 5 times that it didn't work, or it swung back, causing some eye injury and head injury and so on. So if you do use this technique, make sure you cover yourself, your face, and probably the patient too, so that it doesn't catch anyone in the mouth or anything like that, or the eyes even worse, and so on. So be careful with this technique. The safe way for us, that for me to use it is, I usually numb it, or if you don't have any lidocaine, just cut the hook as close as possible where the barb is and just push through it, because the barb goes one way without tearing the tissue as well. Never attempt to pull it backward, because it will cause a lot of tissue injury with the barb going against its, the direction. So just go forward, make a curve like that and push it through, and irrigate the wound really well. Make sure if you're not tetanus up to date, make sure you get up to date on that, and also probably antibiotics for a few days to prevent infection, or at least topical antibiotic, unless it's not too deep. Unless it's deep, then you could use some oral antibiotics. For bleeding, sometimes a scalp bleed can be scary because the scalp and the face bleeds a lot, fingers too. Just put pressure on. And if you have tea has vasoconstrictors, which can slow down the bleeding. So when you put pressure on, just use a tea bag and just put pressure on that with a tea bag, and it helps stop the bleeding sooner. You do the same thing with the scalp in your gum. You can just gently bite on the tea bag and it will help. Can't do that on nosebleed because you can't put the tea bag in there. So just put pressure under the nasal bone here, not over the bone, but right underneath it, over the cartilage. And just put pressure on there. You don't even have to go backward, forward. Just put pressure on there and give it a good 10 minutes. And your body will do the rest. Sometimes I even stuff a cotton ball up there or Kleenex and then put pressure over that so it doesn't drip all over the place. If you do that and it keeps bleeding, then time to get seen in the urgent care. Also, find out what caused the bleeding. Sometimes allergy can do that. So I've successfully used nasal spray to help reduce inflammation and bleeding. Make sure that when you use the nasal spray, shake and go sideways like that in between your ear and your eyes. That's the direction of your nasal sinus system, and it will help reduce inflammation. And then a few times a day, also use the ocean spray to spray that many times. Once it's moisturized, it's less likely to bleed. So that's the trick for nosebleed. Stopping the nosebleed bleeding. And if you're on warfarin or some sort of blood thinner, that will be a more difficult problem. And also, if you have bleeding and it keep going back to your throat, even though you don't go backward like this, then you have to think about bleeding in the back. Then that's something that can be dangerous, affecting your airways. So you need to call 911 even and have ENT involved to start the bleeding right away. For bleeding from body parts, if a part of a finger is cut off, try to save the cut off part. Depending on the skill set of the people that treat you, if you save the part, that can be put back. If you bring that part back sooner rather than later back, the fingers has a best chance to survive because there's a lot of blood supply in the finger. One time I was able to put back a small piece of the finger that a patient of mine, his daughter actually saved it for him, 14 stitches. And it actually took on the suture removal. It was healing really well. When you save live tissue, don't put it in ice, but put it in cold water in a paper tissue and put the body part in there and then put the whole thing in ice, in an ice bag. That way it doesn't get frozen, but it doesn't get too cold either. It doesn't get too warm either. So keep that in mind when you save a body part. Oh, this is an interesting one, is tongue stuck in a bottle. Sometimes kids put their tongue in a bottle or they try to lick the last drop of honey or some yummy juice. And then as they keep doing that, sometimes the tongue gets swollen and it gets stuck in the bottle. And then as it gets stuck, it becomes a little more inflamed, making it harder to get it out of the bottle. So the trick is that if you can find a way to put a small in the healthcare setting, we use what we call an angel care connected to a 20 ml syringe. But if you can find something similar to inject air where you can enter into the bottle between the parts of the tongue and just put a lot of air in there. So when you increase the pressure inside the bottle, the pressure will push the tongue off the bottle using the air pressure. Just put as much you can do can in there and in the bottle as you can. So that's a interesting fix there I found. Another one is avulsed tooth. When you have an avulsed tooth, that's a dental emergency, and the tooth should be stored in milk and be inserted right away and bite down for a few minutes, and then you can use some sort of crazy glue to keep the piece in place. Make sure that the tooth is dry when you crazy glue it, and try to bite down gently to keep it in place for a few minutes, but not too hard so you don't break it off again. And get an emergency dental follow-up. So that's, I think it had to be within 24 hours in order to save the avulsed tooth. Make sure that, it's the milk will help preserve the tooth. So if you can put it back and had to see the dentist as soon as possible. All right, we're going to stop there. So in summary, we talked about injection of paperclip, screw any sharp object, marbles, and then we talk about removal of splinters, ear foreign bodies, fish hook from your skin, and also some tips on bleeding, how to stop bleeding, also stopping nosebleed, and also body part missing or cut off, and tongue stuck in the bottle, and also avulsed tooth, how to make sure that you do not lose that tooth. Because when you lose it, it may need a dental implant, which will cost you several $1,000s, and it doesn't happen right away. So save that tooth, very important. All right, thank you for tuning in for this session on the home medical care tips, part 3. And let me know if you have any feedback, comment, what you have done in the past in the clinic that you have as a healthcare worker or not, or as a patient. Thank you so much.